Hi, my name is Dr. Alex Tam in Vacaville, California. For a lot of people who are not aware, chiropractors have been preaching about your nervous system and about your health for over the last 100 years. Over 100 years, we've been talking about boosting your immune system, what you can do right now, how does getting adjusted really just spikes your immune system and your spine and how your body actually functions. I feel like we've been the only one talking about, and among naturopath, other doctors, that really talks about how to allow your body to heal itself. Right now, during this pandemic of COVID-19, it is more important now to know how your body works than any other time before. Because people want to know now. See, when something like this hits your body, COVID-19 is known as a nervovirus. A nervovirus means your body has never seen it before, and that's why it's hitting our society so quickly. And when you are dealing with something that you've never seen before, guess what? Those who are more immune compromised, people who are lacking a good immune system the most, will suffer the most. Reason being is because your immune system is not ready to deal with what's coming at you right now. Your body could be dealing with so many other things. Like, for example, people who have heart disease, people who have diabetes, okay, people who are dealing with cancer, right? Other autoimmune functions. The difference between a virus and a bacteria is that these viruses, they will take over your cells. They take over your cells and cause damage to your cells. And if your body does not have enough of a good immune system, T cells and white blood cells to fight off these viruses, now what happens is you end up getting sick yourself, right? So that's really, really important, is you can't overcome it if your body is already so compromised on its own. Now, how, you say, well, Dr. Tam, how do I get my body to a point, even if I am immune compromised, or maybe if you're not immune compromised, how do I get my body to work the right way? Well, number one, you have to make sure you take great care of your body from now on. There's no other option. This is not optional anymore. People are seeing that. People are dying out there left and right now because of a compromised immune system. So one thing that we should all learn from what we're doing right now is that we should no longer be compromising your immune system, okay? So how do you boost up your immune system? Well, look at things naturally that you can do first. Let's look at what you can do naturally. You have to make sure you're getting enough water. What's enough water? A minimum of water is half your body weight in ounces. If you are, let's do the math. If you are 200 pounds, you have to drink at least 100 ounces of water. But the thing is, if you want to flush out toxins right now, you have to drink not just 100, maybe 120, 130 ounces. So 128 ounces is 1 gallon, okay? So think about that, right? Now, initially, you're going to go to the bathroom a little bit more because your body's not ready for it. So your kidneys aren't really ready. So your body's like, hey, I'm getting all this water, but I don't know what to do with it. So your body's going to flush it out. But give it a few days, your body will learn to absorb it. All right? Get enough water. Our body is about 70 to 80% water. You need that. Number two, get enough sleep. All right? You have to get enough sleep. We are, as in America, we are one of the least sleeping hours, okay? We are rated at, I think, 6.5 hours a night, whereas people in Switzerland and Sweden, they were rated at 7 hours and 45 minutes. So you got to make sure you get enough sleep. Think about this. Sleep is how your body heals. So do you want your body to heal? You do, right? So make sure you get enough sleep. Okay. Third thing that you can naturally do, we're not talking about supplements or anything yet right now, okay? I'll get to that in a moment. The third thing that you can do, okay, and this is very powerful, is avoid foods, and you know it. You know what it is. A lot of you have have a sugar craving, you have a sugar bug, a sweet tooth, okay? You have to avoid foods right now that is going to be processed, that is not healthy for you, all right? And you got to avoid it right now. See, you have to do this more now than ever before. You know what's right. You know what's wrong. I know a lot of you know it. Just like you know that exercise is good and smoking's bad for you. You know eating vegetables are good and French fries are bad for you. You know that. You got to practice it now, okay? You have to practice it not just for you, but for the people around you, for your kids, all right? Other doctors and nurses that are listening to this right now, you have to practice this. It is completely ironic to have a doctor talk to you, right, about health, and then the next thing you know, you walk outside and you see a staff smoking area in the same facility. So you have to do that. Those are 3 things that you can do naturally, all right? The 4th thing is, I think really, really important, is food. The amount of the choices of food that you make, the amount of greens that you take in, okay? That is so important because you want more greens. Your body needs more greens, green, leafy, dark leafy vegetables. That's what you need. This is a longer video than I expected, but let's get to what are some of the supplements that your body absolutely needs right now. The number 1 thing that you absolutely need. See, the reason why you look at in the background of me right now, we have 2 shelves of supplements. I don't have 10 different shelves of supplements that you need because for me, if I take it and it's good enough for me, my mom, my wife, my family, it's good enough for our patients. If it's not good enough for us, I'm not going to put it out here. I don't have 5, 6 different multivitamins to try to sell you because I believe in one and the one only, and I believe that one's the best one. And that's the one that I'm going to let everyone know, this is the best one, go with this one, all right? Because the other stuff is just, it's got too much binders and fillers, or maybe I haven't verified whether or not they're good, okay? So I wanna show you guys this. There's a roll, on this shelf right here, it's this second row when you come into our office. Right in the middle, it says multivitamins. The first one on the right here is called liposomal ultravitamin. It's the ultravitamin that your body absolutely needs, okay? Then we have a chewable one for kids, right? And then on this side, Immuno Plus. If you want to boost your immune system, you're going to need something like this. I want to show you what's in it. Right now, when you look at this here, there is astragalus extract, and there's an elderberry. That's the one I really, really like. Green tea extract, okay? Escacia. These are all things that if you look up, shiitake mushrooms, maitake mushrooms, a lot of 3, 4 different mushrooms in here. These will really, really increase your immune system, all right? So Immuno Plus, we have that. We have a liposomal C, a liposomal D, all right? And there's also the methyl B complex over here, all right? But on top of that, one thing that you heard me talk about time and time is our glutathione, okay? For some reason, it's not focusing in on the glutathione. There you go, glutathione, all right? So to recap, a multivitamin, okay? If the liquid multivitamin might not be the best for the kids, they don't like it, there's the chewable, the best one there. If you're thinking about vitamin B, that's the best one right here, okay? You need that Immuno Plus on top of everything right now more than ever before. You need vitamin C to really start the cascade. Vitamin C is like the ignition starter for your immune system. If you're not getting enough sun, you need that vitamin D right now, all right? And then also, you need that glutathione. Glutathione is going to help you really, really support detoxification and your liver. So those are the few supplements. Our office is open to the whole public, okay? So you can actually come in, purchase the supplements that you need. But I want to show you guys what's at the front of our door because this is really, really important. You see these pink notes that we have in front of our door right now? Okay, I want to show you what it says on these pink notes. I'm gonna come out here and show you. One of the things that we're doing to make sure you guys are all protected is that if you're sick, stop. For your safety, do not enter the office for public health regulations. What we're doing here is we want to make sure that we keep all of our patients well. We're not a sick care facility. We are a wellness care facility, all right? So I want to let people know that for everything that we do in here, we're wiping everything down on the hour after every patient, and all the counters, we're keeping everything clean. This is a cool, really cool idea that one of my staff came up with. When you people sign in, you take a new pen and you drop it into a pen that's to be cleaned. So we also have Purell, everything that we need for our patients. So you need to get healthy. If you want to be healthy and you don't know how, we are the premier place to go to learn about what we can do to help you. If you're in pain, if it's maybe a herniated disc or a lower back that's never gotten better, look at our decompression suite right here, okay? And we're spreading everyone out in this room. Most of the time, only half these tables are getting used right now because we're spreading our appointments apart. I hope you guys learned a lot today about, number one, what health is, how to get healthy. You know, my whole goal is to make sure that you guys stay healthy, be great, okay? And we're gonna all live and function through this time. I know it's difficult for a lot of you, and I understand that, but right now you gotta take better care of yourself and your health and your family's health than any other time in the world, okay? Have a great day.